I do think it can take quite a while to do a mommy makeover. If you're doing tummy liposuction and breast, yes, for sure. That's probably 6 hours. And, this comes up all the time, and it just depends on how much liposuction we're doing. Patients often will be like, well, can you do a little outer thigh liposuction? You start to go down that rabbit hole of I'm already awake or asleep rather.
Right.
I'm awake, right? I'm awake.
I hope so.
You go down that rabbit hole of I'm already asleep. I'm already having surgery. What can I add on? Which, as we mentioned earlier, put the fat somewhere. That'd be a great idea. But also they're like, can you lipo my arms? Can I do a labiaplasty?
Labiaplasty. Very
et cetera,
popular.
et cetera. There are some small things you can do. You do not want to do too many things. First of all, my OR cuts off at 8 hours, and that's being pretty generous because some people will say no to 6. I think it has to do with the component of like, what's the safest amount of time I feel like I can operate, and also how accurate your times are. So when I say something's going to take 6 hours, you know me, most of the time it's going to take 6 hours. Not it's going to take 6 hours and it really takes 7.5, because that's kind of the trend among surgeons is to underguess. So if I'm saying 8, I'm not saying it's going to be 10. I'm saying
that's how you make a
8.
really angry scrub tech.
And anesthesiologist. If the case is always 3 hours.
He's like, I have to keep sitting in my chair for that much longer. What movies should I watch? Just kidding. I've been watching too many memes on Instagram.
Oh, about anesthesiologists? Yes. I mean, we love our anesthesiologist.
He's awesome.
But we also love making fun of him.
It's even better. He's the only man in an all-girl office. Poor guy. It's just too good.
Yes, we're having an influence on him for sure.
All of our Daily Mail topics in the OR, he's like, I go home and I tell my wife I learned all these things and I feel like she thinks I'm so cool and I feel like the cool dad. It's like, we got you. Don't you worry. We'll keep you all today about J-Lo and Ben and his Fox Hawk and everything else under the sun. I can't stop saying it.
It's so good. So it looks like Jenny Mullen did have liposuction under her chin, which explains that photo of that thing wrapped around her, which is a procedure you can add on, right? That's like 30 minutes. And, it's not the biggest. It's not, it just adds about 30 minutes to your case. And
it looks like very Mean Girls, like the nipple cut out.
Why does she have like a pink? It's fine. Anyway,
it's fine.
What I was going to say, a common ask is arm liposuction. And honest to God, you do not want to do that while you're doing a mommy makeover because your abdomen's going to hurt and you kind of need your arms to help you get up and down. And so adding arm liposuction, I usually try to talk people out of doing that and have them do it at a later date.
I'm just going to say from my own personal experience here, I have done lipo on my arms and legs at the same time. Worst idea ever. I could not move. I was like a stick, like a little board.
Yes.
I was like, can't move my legs, can't move my arms.
Yeah, I think it's just, the problem is that, again, you're going with the theory I'm already asleep, and the other theory that it's just liposuction. No one should ever say it's just liposuction.
What does Dave say? This is the best. I say this to patients.
Yeah, so my husband's a surgeon, a general surgeon, and I was telling him about another doctor that I operated on.
Everyone thinks lipo is the most painless surgery.
Yeah, and he was so surprised. The patient was so surprised how uncomfortable and painful it was afterwards. And I was telling my husband about it, saying, hey, there is this doctor, and he's like, oh my God, this hurts. And he's like, well, you're taking a steel tube and ramming it in and out of their subcutaneous tissue. What wouldn't hurt about that? And I was like, oh, okay. That's not, I mean, there's some finesse in there, but yes, I see what you're saying. It's like, sounds so barbaric.
I know, but it's a good way to explain it to people who are like, I didn't think this would hurt at all.
Yeah, it's definitely, you're going to be sore. You're going to feel like you went a couple rounds with a boxer and you were on the losing end of that. Then you're swollen and uncomfortable. So I think if you're mentally prepared that liposuction's not going to be zero pain, then you're fine. But if you think this is going to be no big deal, that's when I think people get in trouble. So it's just managing your expectations.